With me is our next guest, Phil Roberts, who is the Chief Executive of the World JourneyMEN, a charity that specialises in men's mental health. Good afternoon, Phil.
Good afternoon, Helen. Thanks for having me on.
Delighted to have you. First of all, tell me your thoughts about, are you surprised by the report's findings?
No, not surprised at all. Mental health before the pandemic, we were struggling and needed further investment. The pandemic, it just showed how far we were behind. JourneyMEN, we opened right at the beginning of the pandemic in April 2021. And you know what? If there was ever a time to open a mental health hub for men, it was there and then, because our phones started ringing near enough on day one, and they haven't stopped since.
And Phil, just without revealing identity, just recap for us what it's been like over the last 18 months and with more people contacting you and coming through the doors. Maybe give us a couple of examples that we can try and relate to of those areas of issue and concern for individuals.
Yes, there was right at the beginning, we had unknown disease that we all know about now, or we're finally getting our heads around it. But at the beginning, it was a scary time. Places were closing down, services were closing down, people were worried about the jobs. People were really struggling, and being stuck in a house all together, all at once, being told that you can't get out. It was scary, and people were really struggling. The people who were struggling beforehand were really going towards crisis point. We were getting calls very, very early on in the pandemic with regards to thoughts of suicide. We had some of our men who have attempted on quite a few occasions, and they were then talking to us, and we were having to put plans in place. But basically, one hand tied behind our back, because a lot of the services that we needed to speak to, a lot of them were either closed down or going through the transition of dealing with COVID.
Just couldn't win, could you? It's kind of catch-22, isn't it? And for you, as an individual, kind of the chief executive of the organisation, what do you think have been the main causes that have impacted on men in particular? COVID reducing already, low incomes for some families. People aren't still over this, are they?
No, COVID it's not going away. I know that we don't have to wear masks or anything like that, but COVID is going to be here to stay. And this long COVID, not only in your body, but also in your mind, it's always going to be there as well. People are worried about further lockdowns, and now people have been told to go back into the workplace. People are worried about going back into the workplace and going out and socialising. It's still a worrying time, but the men that we're talking to, it's great, because at the beginning, where we were told we can't go out, we can't talk to anyone and things like that, now, all the way through COVID, we've been doing some of the social events. We've been working around the restrictions. We've been having walks and talks. So we've been getting our men to talk, not just to us, to other men, or either online or phone calls or face-to-face. Also talking to the family. Be honest about how you're feeling within your family. If you're struggling, talk to your husband, your wife, your girlfriend. And it works. Talking therapy, it's not rocket science, but it proves it works.
And what about, projection, Phil? What's the answer to this situation? Do we need a better deal when it comes to how the national economic cake gets sliced up?
Well, mental health services, hopefully out of, the government charging us extra for what's been happening over the last few days, and what's going into government about how much extra we're going to be charged. Hopefully, some money from that may filter down to the mental health services. What I've found is, especially the last 18 months, the third sector have really stepped up. And it's the third sector that, we're working alongside our partners, the amazing guys in the emergency services. We're joining the services together, working smarter. We're saving money, reducing people going into hospital and also people going into crisis points as well, because once that crisis point, it costs a lot of money, and sometimes people don't come out of crisis points, and that's where people unfortunately do kill themselves.
Yeah, and I think there needs to be that platform of other activities and signposting and all working together. As you say, the third sector have really stepped up. In other immediate concerns, what in the short term, Phil, do you think can be done to help people with their mental health problems? How can, for example, just give us a bit more about Wirral Journeymen for our male listeners and relatives listening right now, maybe concerned about a loved one? What is the immediate that you would advise?
I would say first point of call, if you've got a concern about a male in your family or anyone, speak to the GP. They can put a care package and escalate things accordingly and work with the other services. The third sector, and especially me here at JourneyMEN, all what we need is the individual to give us a ring or refer online, and we can assess them once the application comes to me. It actually comes to me. I'll assess it, and then I know what staff member that job has got to go to. And then that's where that man starts the journey, and that journey stays with that staff member all the way through. So they haven't got to go over old grounds. They get that report, they get the trust right from day one, and that staff member stays with them throughout their journey. And we've got some men that the journeys have been still going on, which is great. We've had some journeys that have lasted a couple of weeks or a couple of months. But once that journey starts and stops, if the man has further issues in a couple of weeks or a couple of months, all they've got to do is pick up the phone, and I will press the button, and they go back on the system. They haven't got to get reassessed or anything like that. So we make things as easy as possible. We don't get tied up in red tape.
Yeah, and messed about and passed from pillar to post. That's what I love about the organisation, because you're doing exactly what it says on the tin, a journey together.
Yeah, definitely. And that includes the family. It just doesn't stop with that man, because mental health just doesn't stop with that one person in the house. We talk to the wives, the girlfriends, the boyfriends, also include the kids in the activities as well, and do it as a family thing as well. So, we're discussing mental health quite up front sometimes, and at the social thing, events like today, we've had a walk and talk and a fishing event on today, and the men can bring the wives, the girlfriends, the kids down there, and we can, we're just celebrating being alive in a very difficult time in this, in this beautiful weather today.
Definitely, Phil. Give us a heads up on contact. If anyone wants to get in touch with Wirral Journeymen, how do we do that, Phil?
Yeah, the best place is have a look at the website. That actually tells you exactly what we do, what we're all about. All the contact is on there. So if you just go on JourneyMenCIC.com, and it's on there. We're based at 56 Chester Street in Birkenhead. We're on Facebook, we're on Twitter, we're on Instagram. You name it, we're so contactable now. And we can go old school. The telephone number is there as well. And all you've got to do is give us a ring. But we also deal with all the other amazing third sector people, and all the people. Like, we've just got a mental health crisis cafe in Birkenhead, so we're quite fortunate in this part of Birkenhead. And people financing in Birkenhead, got to help here.
Phil, it's so wonderful. Listen, we're going to cut it short because it's just broken up slightly there at the end. But many thanks for coming on to update us here on Drive. Just give us that last bit again about where the mental health cafe is.
It's Hamilton Square. It's called Campaneros Hamilton Square, and it opens at the CWP NHS mental health hub, and it actually opened last Monday.
Wonderful. Phil, a pleasure as always to catch up. Many thanks for updating us about Wirral Journeymen.
Thanks, Helen. Have a good show.
And you as well. Enjoy the rest of Wednesday. That is the chief executive of that organisation, Wirral Journeymen. And if you want to find out more about signposting, then get in touch via the various ways for social. Indeed, if you put into a search engine as well to get all of the details.
Helen Jones.